Okay, there we go. I think we may as well get going. So welcome to the Winter Mental Health Action Group. Hope you're all keeping cosy and warm. And I'll just put the agenda up where which will allow maybe a few more people to start joining. So it's a fairly packed agenda today with some news from Southdown. We've got an update on neighbourhood mental health teams. I'm not sure if Dave's here yet, but Dave's going to give an update about Seaview. Peter's going to talk about Mind, Brighton and Hove projects. We've got a quick update on the mental health network. Andrea, unfortunately, has had to give last minute apologies, which is why I'm wondering if we might run a little bit ahead, which is fine. I'm going to give an update about mental health communications and cost of living. And Jenni, as usual, has got her slots on suicide prevention. And then at the end, if people have got any news to give or anything they'd like to say, that's the opportunity at the end of the session. And we'll have a break halfway through just for comfort, for you to get up and have a stretch and get yourself a cup of tea. Okay, so we've got a new person on the group today who's come along as a guest, Mark. Mark, are you there?
I'm here, yeah. Morning.
Okay. Are you happy for me? I think you've only got a couple of slides actually, but shall I just move on when you say?
Yeah, that's fine.
Brilliant. Thank you, Mark. So yeah, Mark's just going to give us an update and describe the Staying Well service, which operates with 2 sites. I'm sure you're aware of it, but to give you a little bit more information about it. So I'll hand over to Mark.
Thank you. Good morning. I'm Mark, Service Manager for Staying Well East Sussex. So I'd like to just share an overview of Staying Well services and our opening times during the Christmas and New Year period. So at Staying Well, we remain open as usual throughout the festive season, and we operate 365 days a year, ensuring continuous support for everyone who needs it. So Staying Well is an out-of-hours crisis prevention service for adults aged 18 and over who are experiencing mental distress or feel that they can't cope. And we provide a safe alternative for people who might otherwise go to A&E when this isn't the best option. So our approach is psychosocial support in a safe therapeutic environment, and it's delivered by Southdown and in partnership with SPFT. So all Staying Well services now across Sussex operate on an open access model, and meaning clients no longer need to call ahead and they can simply arrive during opening times. And our opening hours are weekdays at 5 p.m. till 10:30 p.m. and weekends 3 p.m. until 10:30 p.m. And when a client arrives, they can ring the intercom, answer a few risk questions, and then enter for support. But please remember that open access is only available when there's an SPFT clinician present, and otherwise we revert back to a same day access and clients will have to call ahead. On each shift, we have a clinician, 2 recovery specialists and a peer worker, and we also provide a safe cafe space, which is it's a relaxed environment for clinical, peer and social support, and this helps clients build coping strategies and recovery skills. Our peer support workers who have lived experience are available for informal conversations, and we also offer crisis intervention meetings, and these are led by the clinicians or the recovery specialists, and they focus on safety planning and crisis management. And clients can self-refer in person on the night, or by phone or online, and we also welcome professional referrals. And while our main approach is face-to-face support, video sessions via Attend Anywhere and telephone options are available if a client needs that. So at Staying Well, our aim is to reduce the need for emergency department visits by preventing crisis from escalating. We provide a psychologically informed, non-judgmental environment that promotes independence and aids recovery, and we empower clients to identify their needs, make choices, develop coping skills, and create safety plans using a strengths-based approach. And we offer walking access for faster support without lengthy waiting times, and we challenge preconceived ideas of mental health services by providing expert support in a safe, relaxed, and a non-clinical setting. Thank you.
Okay, thank you. And you were just going to say something about Christmas opening times, Mark.
It's business as usual. Yeah, it's the same as on the slide. It's 5 till 10:30, 3 till 10:30 at the weekend.
Okay. Yeah, and I've actually visited the St Leonard's site, and it is. I mean, it's not home from home because it has to have all the fire regulations and things like that. But it's actually, you can feel it's psychologically informed. You know, it's a really nice space to be in. Has anyone got any questions for Mark about the crisis cafes? Ros.
Hi, good morning, everyone. I'm Ros. I'm from CCAM. I'm the mental health clinical lead for Sussex. Mark, could you just let me know about your drug and alcohol policy, please, if somebody was attending?
Yeah, so what we want from our clients is that they're to be able to engage. So if they've had a drink or they've taken substances because that's what they do, we're not going to refuse somebody just because they've had a drink or a few drinks, but we do want them to be able to engage and you know, have a good conversation and to be able to receive the support.
Okay, thank you. And Frederick's got a question.
Yes. Good morning, Mark. Do you have a
Morning.
telephone number that would help us to link with these crisis cafes?
Yeah, maybe I don't know what the next slide is actually. I've forgotten.
I think it was on the first slide.
Yeah, sorry. So
Yes.
there's our phone, numbers and
Yeah.
a hashtag for each service.
And we've put Brighton in there because obviously a lot of people living in East Sussex are kind of on the border and they can go to the Brighton one. Is that right, Mark? So yeah.
And we have a branch in Brighton as well.
Yeah.
Right. So yeah, so this is a service that's there every evening and during the Christmas period and New Year as well. So part of the suite of services, and a very important one for people who may be in crisis at that time. Are there any other questions for Mark? Okay, lovely. Well, thank you very much for coming, Mark. That was really helpful to know, particularly at this time of year. So yeah, thank you.
Thank you.
Right, so moving on. So Ian's going to just tell us what's happening with neighbourhood mental health teams. We've had regular updates about this, and it's a huge piece of work going on across Sussex. Anyway, I'll hand over to the expert, Ian. As I said, Andrew's not able to join us this morning, so Ian's going to be doing this piece. I thought Ian was here.
Oh, here I am. I was talking away without my microphone. Not very helpfully. So yes, stuck with me this morning. I'm Ian Dyer. I am the Programme Manager for Mental Health Integration in East Sussex. So I've been working on the Neighbourhood Mental Health Team programme for a few years now. And yeah, I can give you some updates as to where we've gotten to with it. Like Sarah says, we've been here many times to talk about the plans around how we're trying, I guess, what the model is and how we're trying to get it implemented. But we have really managed to move some things forward. So just to really let you know where we've got to and where we hope to take things next, really, I think today. So if we can move on, Sarah, please. So, headline news. On the 8th of December, it was agreed that across Sussex, 15 neighbourhood mental health teams that we formed have officially gone live. In East Sussex, we've got the 5 teams shown in the map there. What that means is really that across, if we talk about East Sussex, across East Sussex, we've got a set of 5 neighbourhood teams that have come together, including staff from different organisations that have previously been quite separate and separated by organisational boundaries, that are now working really, really closely together and able to provide much more seamless offers of care, much more seamless ways into mental health services and through them as people's needs change than was the case before. As it says on the slide there, the teams are bringing together NHS and voluntary and community social enterprise partners in East Sussex. That's SPFT and Southdown in the main part. So those partners are coming together to offer integrated person-centred mental health support and working really, really closely with GPs as well. So what we're really trying to do and what hopefully the neighbourhood team offer will achieve is much closer, much more integrated, much more joined up offers of care for people with mental health needs in the community. So we've gone live, we've got the teams operating, we've got them aligned to the 5 areas in East Sussex. The teams know who they are, they know that they're working together, they know how to work together with the meetings we've got set up. But, you know, we haven't got everything fully ready yet. So between now and, as it says, in spring 26, we're going through a period of model optimization, we're calling it, where we're really trying to really just smooth off the rough edges, really make things as tip-top as they can be. And one of the big things that we'll need to be doing with alongside our integrated care team, integrated community team colleagues, is really working out how can the NMHT model and the integrated community team model really become as joined up as possible as well. For anyone that's not aware, integrated community teams is a similar program of work that's going on across Sussex with similar aims in terms of bringing together separate offers of care, separate organisations to deliver joined up offers of care for people with more complex health and care needs more from the physical health side of things. So perhaps people with frailty and long-term conditions. So that's a programme of work that's going on, and eventually we really want to see NMHTs and ICTs being a part of a whole picture rather than separate entities. So there's work to go on that will need to be done to get to that point. Okay, if we can move on, Sarah, please. So there may be a bit of confusion out there, and I hope to clear this confusion up. I hope I'm not going to cause any confusion by going through this, but people may remember probably some of mine and Andrew's previous presentations where we were saying that we wanted to bring the NMHTs to the point of becoming live at the same time as the rollout of SPFT's new shared electronic patient record system, EPR system it's called on there. SPFT have been introducing a new EPR system to record its activity and have its clinical notes on, and a really, really fantastic outcome for NMHTs is that it's been agreed that all NMHT staff will be using the same system, which will make things much easier in terms of creating joined up working, people only needing a single care plan, a single risk assessment, rather than multiple of those things. And we really wanted to be able to deliver our NMHT model and start delivering it at the point that the new System 1 became live. And we were hoping that that would happen towards the end of November. But it's a massive IT project, and like all massive IT projects, there were delays, and the System 1 is now not going to be launching until the 2026. So we had to make a decision as to whether we delayed our launch of neighbourhood mental health teams, even though everything else that we needed to put in place was ready, or whether we said to the world, actually, we are operating as neighbourhood mental health teams. Everything that we need to have in place is in place, apart from the shared EPR system. So we decided to go ahead, and we're basically back on the 8th of December. Hopefully some people may have seen the comms on social media and other places. We decided to go ahead and let everyone know that actually in East Sussex and across Sussex, we do have functioning neighbourhood mental health teams. They're just not yet able to record all of their work on the same system, but they will be when the system goes live early next year. So if there's anyone confused around the fact that we're not using the same system, that's why. Okay, if we can move on, Sarah. So, as I said, lots of things to do next in this optimization phase. Of course, not least of that is getting the NMHTs onto the new system when it goes live and make sure that all goes smoothly and works. But there's lots more work as well. We know we want to better integrate our primary care mental health practitioners and our emotional wellbeing services into the NMHTs. They are working together in line with the NMHT model, but the plan is to actually have them integrated into the NMHT management structures. Currently, the PCMHPs and EWS services are managed by our Health in Mind teams, and they're going to move over to be part of the fully part of the neighbourhood mental health team and the management structures within that. So that's work that will carry on, and hopefully will be ready, that will be completed early next year as well. We want to develop what's called our standard offer to make sure that every neighbourhood mental health team really is clear around what the clinical and non-clinical parts of the offer to clients should be. That's work that has got delayed. There's been some clinical leads that were really working on that, but unfortunately they had to take a lot of time off for personal reasons. That's delayed that piece of work, so that will need to continue into the new year. We want to make sure that as we deliver our new models that they are working and are being effective. So we are designing, we'll be rolling out in the new year, service user surveys, staff surveys, carer surveys as well, and a thing called a fidelity review, which is really trying to make sure that across the 15 neighbourhood teams across Sussex, we've got a sense of cohesion and coherence, that all the teams are sticking to a standard offer, like we say, in that they are consistent across those 15 teams in terms of what's being offered and how it's being offered. A really, really big part of neighbourhood teams is what we've called our aligned services. So working together really closely with local offers that can't integrate, they can't necessarily use the same EPR system, but nevertheless we need to work really closely with teams like our adult social care, social work teams, talking therapies, CGL, drug and alcohol services, really making sure that our local mental health offers in each neighbourhood are very closely aligned with the other really important offers that people need to have a holistic offer of care available. One thing we're really excited about in East Sussex is the opportunities that are coming from the work that Southdown are doing. I think Rebecca's going to talk about in a minute around redesigning their wellbeing service and really wanting to make sure that the NMHT offer can be incorporated within the wellbeing service and create what we hope will be an open access model to mental health services, similar to what Mark was talking about with Staying Well. People can just turn up somewhere and talk to someone, describe what's going on for them, and get an offer of care sorted out for them really, really quickly without having to go through GP referrals and things like that. So we're really excited to be able to start developing an offer of that nature, and we'll definitely keep people in touch with how we get on with that. So it's probably enough for me. I know Rebecca is going to come in and talk about the Southdown bit, so I'll pause there if that's okay. And I think that's my last slide. Oh, if you want to stay in touch, as always, there's lots of different forums and comms channels out there. The slides will go around afterwards, so do get in touch and join the forums if you want to stay in touch. Thank you, Sarah.
Thank you, Ian. That was really helpful. So yeah, that's just one of the obviously very significant changes that's going on in the mental health landscape. And Rebecca from Southdown is going to talk about the changes that Southdown are considering in that context. So that's going to be our next item. Rebecca, if I can hand over to you. Thank you.
Thank you, Sarah. Hi, everyone. Nice to be here. Season's greetings, dare I say it. Yeah, because I'm going to share the work we've been doing at Southdown. I'm really interested to hear your kind of questions and thoughts and reflections on what I'm going to share. We'll have time for questions at the end. So I've previously been a manager at Southdown, and I'm in this secondment at the moment to lead the design work. And I'll kind of talk you through some of the kind of processes we've been going on. Sarah, can I ask you to move it on? Thank you.
So I was also going to say, can everybody go on mute? Because I can hear a bit of a buzz going on. I'm not sure if that would help if everyone went on mute apart from Rebecca. I'll do the same.
Thank you.
Okay, thank you.
Oh, yes, the buzz is gone. Thanks, Sarah. Why are we doing it? And it links to the information that Ian just shared as well. So as you said, we're a key part of the neighbourhood mental health teams, and we want to make sure that we're able to be fully engaged. And it's working in a different way. So we've had to think a bit about how we organise ourselves to make sure that we are able to be a meaningful partner. Many of you will know that South Down went through a redesign of the wellbeing centres last year. We did that with partners across East Sussex, SCDA, Possibility People, Ollie from the Pelham, I think he's here as well. So that was a really big bit of work, trying to co-produce, thinking a bit about what is it we need to have in our wellbeing centres in East Sussex? What are the unique aspects of our geography and our population that we need to be considering? And then through the work that's happened over the past year, there was, as you know, we went out to procurement to see if there was a suitable partner, and then kind of come full circle and realise that South Down, we will be the contingency provider, so we'll be delivering the service. So then we needed to think a bit about all the things that have happened in the past year, particularly the neighbourhood mental health team's development and organisation, the way things that have kind of internally have changed for us. So we needed to reconsider it, pause, and put all of those pieces of the puzzle together to think about how we're going to deliver this service in the future. One of our key goals is to make sure that we are providing that consistency. So recognising the key theme that's coming out of mental health transformation, which is for any of us, when we need mental health support, irrelevant of where we live and our locality, we should have an equal access to that support. So thinking about how could we really step into that space and make sure that what we provide is fair and equal. We've also, organisationally, we've wanted to be increasing our lived experience workforce for a while. We have a number of peers. Staying Well have peer staff, our other services, Thinking Well, and Recovery College. But obviously we wanted to grow that. So we're thinking a bit about, in this design, how can we bring in more peer staff? And then linked to that, recognising that we have many clients who want to volunteer, but also there's a real opportunity to develop our volunteering offer at South Down. So these are some of the reasons of why we're doing this design at the moment. Thank you, Sarah. So what we've done so far, as I said, last year we went through the redesign of our offer. Oh, sorry. I thought, bear with me, I'm just going to turn myself on at the wall. I didn't do that. There we go. I don't want to disappear midway. Sorry, my laptop was flashing. So yeah, last year we went through the redesign of the wellbeing centres services and all the work that's happened in the neighbourhood mental health teams to really co-produce it. So we wanted our design to build on that. Obviously, the feedback we're getting from clients and from colleagues around how the design is happening. We're keeping staff up to date, but also trying to give information to clients. We've had client and colleague engagement workshops, so we had time to gather, what's going well in the system, just wider than South Down as well. Where are the gaps, and where are the things that we could really reconsider and change and do differently. So we used things called personas, which you've probably come across. They're kind of like thumbnail sketches of people based on real people. And we developed some through the wellbeing service redesign last year. And also the neighbourhood mental health team have them. And they're really useful ways of testing things that you're doing. So you kind of have a person, you think, actually, if as you walk them through your design, what would their experience have been? How are they likely to find out about us? What would the experience for them be coming into the building? What are the services that they would be looking for? And you can really test out your design to see whether it would work for real people. And then we're in the stage where we're engaging with commissioners. So we've been meeting with the commissioning team in East Sussex to share our ideas and develop the thinking around that. And then also you as stakeholders coming to share some of the characteristics of the things that we're designing and getting feedback from people. So we've met with the Lived Experience Action Group and other colleagues in East Sussex, and beginning to go and speak to clinical partners as well to say, this is what we're thinking about doing. These are our proposals. How would they impact the people that you're working with? Thank you, Sarah. So as with all designs, we started off thinking about what are the problem statements, what are the gaps, what are the things that we're trying to solve. So none of these are going to be a surprise to you. And they come back to some of the things that Ian mentioned as well. that we know that there are barriers to people getting support. All of us, we don't always know where to go for the right help. And sometimes the support we can get is dependent on where we live. We heard feedback around people saying that there doesn't feel like there's enough peer support and lived experience expertise, really wanting to develop that. We want to be able to step in. We want to be in the preventative space. We want to support people's mental health to kind of, we want to support recovery. We want to support early help. That's the phrase I'm trying to say. Early help for when people are having mental health difficulties, so things don't escalate. And that really links into open access as well. So, you don't have to wait for a referral, an assessment. The day that you need mental health support, you know that you can go and find it. And then we want to align with the NHS priorities around the neighbourhood mental health teams, and moving into the preventative space as well. Thank you, Sarah. So some of the other things that we've addressed, and it's probably not unfamiliar to all of you, that the financial climate that we're in, and across the sector, the challenges about reduced, the pressures on budgets, no contractual uplifts, those things, which mean that actually we've got a staff team who are their morale's been impacted by reductions and changes, and we want to create something which is more stable and able to flex and be agile as the world changes. This is something that we will be an ongoing process, and I think in conversation with you and through Stuart at UOK, actually, how do we better impact the impact that we have on clients' lives? How do we show that? What are the outcomes that we can demonstrate meaningful? So actually, look, this is the change that has happened as a result of our intervention. Recognising we've got buildings and we don't use them as much as we could, so thinking about how can we improve that. And then the big headline, which is there isn't any additional funding, so anything we create has got to be within our existing funding envelope. Thanks, Sarah. So feedback that we've had from clients, I think I'll just touch on this very briefly. Recognising that drop-in services are just really key. Be able to access something the day that you need it, or very close to the day that you need it, without long waits or complex referrals. And the wellbeing centres in East Sussex, they have begun to, they are now offering open access slots. So we really want to build on that. And as we're staying well, we've seen the evidence of how important that is for people. Recognising the waiting lists can be quite confusing, and people don't always know how long they're going to be on a waiting list for. So that can really add to the feelings of uncertainty. Thank you, Sarah. Recognising the importance of having services in urban and rural areas. And we really dug into how important are dedicated mental health buildings. And I think we've gone backwards and forwards over this in the past year through the design work, and the recognition that you do both need physical spaces that people know are mental health buildings where you can get services and feel safe and familiar, and you need to be able to pick things up and move them into communities where people live. So you need that hub and satellite model. Thanks, Sarah. And then really hearing a lot of stories around people's confusion in navigating the mental health system and the need for clarity around that. So recognising that the neighbourhood mental health teams are going to be a massive step forward in reducing the complexity and us as services working better together, but recognising that there's a real need for that navigation role of someone that understands the system, that can walk alongside someone for a short period of time to help them recognise this is the service that I might need, this is where I need to go and get it, or this is what's happened and why it's happened. Thanks, Sarah. And coming back to the importance of community connection. So hearing from people and knowing it from our own personal experience and the lives of people that we've worked alongside, the importance of being connected to a community. And I think us at Southdown really identifying what is our role in that and what isn't our role. And through this work, really had a clear sense of the boundaries that at Southdown, we're often the bridge between SPFT, NHS, and then the wider VCSE sector. But we're probably not people's end destination. We can't give people that long-term sense of belonging, community connection. And actually we need to support people into communities in their geography or interest or identity, and that's kind of the space that we're in. But recognizing how important that community connection is for people, and how can we best facilitate that, how can we best support people into that as the bridge. Thank you, Sarah. So I'm just going to share some of the kind of the characteristics of the model that are still in development. The first one is around facilitated peer groups. As I said, we really heard that back, the importance of people feeling they're with others who are going through similar experiences. And at Southdown, again, recognising we're not there for the long term. So one of the characteristics of our model will be that short-term support that enables people to build connection and supports them to find that connection elsewhere. Our next characteristic is one-to-one navigation. So again, recognising that people need support to navigate the system, and they often need kind of low-level mental health support that isn't clinical in nature, but that gives them that intervention able to support them to go out and find community connection elsewhere. So characteristics for our model, it will continue to have employment support. We've got employment specialists embedded in neighbourhood mental health teams. It's really key to the future, and we'll carry on doing that. And we want to really encourage Recovery College links. So whether that's Recovery College in our buildings in East Sussex, or whether we have a part to play in Recovery College in the future, but recognising that that feels like a really key part of, when you come to a dedicated mental health space, there is psychosocial support, but there's also psychoeducation support. So crisis support is our Staying Well service that will continue to be part of our model and be part of our physical buildings. And there's two new characteristics of the model, which are, first of all, we're looking to create a role that's like a neighbourhood lead, someone that's dedicated leadership role within the neighbourhood, and they have a link with local VCSE partners and NHS partners, and they're really there to create a vibrant offer in the hub buildings and to link Southdown and other partners. So as a person coming for mental health support, you don't know who's delivering it, but you know where you can go and get it. So it's create that seamless offer. And then the final thing that this is really kind of going to rely on is having neighbourhood hubs, physical spaces where people can go and they feel familiar with to go and get mental health support, alongside us being able to kind of have an offer where we can lift it and move it to other locations to make sure people across the county are getting a similar offer, to irrelevant of where they live. Thank you, Sarah. And then some of the aspects that I think I've pulled out as we've discussed, but just to kind of name a few. So as we said, open access is going to be a really key principle in the future, which is people don't have to refer, they don't have to wait for an assessment, but that happens, that's much more immediately accessible. Recognising that's not going, because of the kind of the reality of the resources available, we're not going to be able to do that 5 days a week in all locations, but ensuring there is a spread across the county and it feels more equitable and people know when that space would be. We're looking to look at a lot more digital solutions. So recognising that digital doesn't work for everyone, and we will need to kind of cater for people that also need telephone, written, verbal information. But actually, as a majority, to kind of increase our reach and people be able to access us, looking for some digital solutions. That might be kind of booking into a slot online, or it might be kind of in our spaces, just how we can use digital more to make information flow quicker. We're looking to kind of get some clinical input into our groups offer in particular. We want to make sure that that offer is really robust, that it is transferable to different groups, and that we can kind of promote it and have a real confidence that this offer aligns with the other clinical offers out there, but really clear of the boundary, which is we are not clinicians, we're not offering a therapeutic intervention. And I think the other thing just to touch on is around the structured approach to group work. So at the moment, the offer is much more kind of like ongoing membership, and because of kind of the things I've touched on today and the kind of the themes and the space that we're that South Down feels that we're now in is looking much more at a structured approach to the group work, which is there's kind of a beginning and an end, and then we support people else to access that longer term support elsewhere. So I think that's my last slide. Thank you. So that's kind of a whistle-stop tour of some of the thinking behind the work we're doing and where the space that we want to be in. I'm really happy to take questions and to hear kind of ideas and feedback. Thank you. Thanks for listening.
Thank you, Rebecca. So yeah, we're very excited about this because I think it will help people to recognise and access a really friendly space where people understand the system and can help and people to access and navigate both to South Down's own services, but other services like talking therapies and other VCSE support. Does anyone have any questions at all for Rebecca? Frederick.
Thank you. Good morning, Rebecca. You've shown the characteristics of the model, but is this going to be a formal presentation and announcement when it is ready for the general public?
Yeah, good question, Frederick. Thank you. Yeah, so the stage we're in is sharing kind of the principles behind it. In the new year, we'll need to go through kind of our internal processes with our colleagues at South Down and with clients. And then we'll come back to you. It will be kind of like March time with this is the final proposal. This is kind of gone through the whole process, and this is what the model will be from April 2026 onwards.
Right. And will this be approved by the NHS?
Oh, yeah. So I think, we're indirectly funded through the NHS, and we're accountable to our commissioners who also kind of have their governance structures. So I guess it's delivered alongside the NMHTs, and it is it's a model which needs to make sure that it is accountable and appropriate.
I guess it's worth saying, Rebecca, that in the redesign process, you've had input from colleagues from NHS organisations, haven't you, as part of the co-production approach. NHS services have been consulted and had an opportunity to put their views into how things could look, and the open access bit that we're trying to add into NMHTs is really responding to requests from NHS services to be able to take that approach. So yeah, hopefully NHS partners have contributed to the model, and we hope that we'll be able to respond to their needs in doing things this way.
Thanks, Ian. Yeah.
I asked this question, Rebecca, because with the NHS approval, will this become a national policy?
Oh, I see. So, I mean, I guess we are a local VCSE provider, and we're creating something that responds to kind of the NHS priorities and. But I think different areas have responded in different ways. But I do think that the key aspect of transformation is that consistent delivery, isn't it, of like wherever you are. So I think and I guess the fact that we're working in partnership with neighbourhood mental health teams, that's also a national approach. But interesting question, Frederick. Thank you.
Yeah.
I was thinking of the Sussex partnership.
Yeah, so Sussex Partnership are very involved in all of this work, and like I say, that they've really helped shape the model that Rebecca's and her team are developing. They're a key part of the neighbourhood mental health team model and the process that's got us to the point of being able to deliver them. I think in other areas of the country, the community transformation programme that this is all sort of adhering to has been rolling out. We've been using a lot of modelling on areas like Dorset and Somerset and Liverpool that have all really adopted very, very similar approaches to this. I'm sure other areas of the country probably are as well. You're all at different places in our transformation journey. And, we're trying to learn from best practice, and if we develop anything that gets looked at as best practice in any way, we'll definitely be sharing it. There's lots of national conferences that end up happening, and regional NHS meetings where we're asked to talk about how transformation is going. So yeah, it's very much a national endeavour being delivered locally.
That's good.
And also perhaps worth saying that because Southdown are also commissioned to deliver community mental health in Brighton and Hove, that it's going to be a fairly uniform, correct me if I'm wrong, Rebecca, but across East Sussex and Brighton and Hove.
Yeah, no, thank you, Sarah. It's a really good point. So one of the things that we're trying to address is that we have had a kind of funding reduction in Brighton and Hove. So we needed to create a model that was both consistent and responded to that as well. That was a driver, but not specific to East Sussex. Yeah, thank you.
Thank you. And Dave, you've got a question.
Yeah, thanks, Sarah. Thanks, Rebecca, for that update. That's really, it looks fantastic, and I'm pleased to see the open access approach as something that we've been doing at Seaview for many years now, and will be really good as things kind of develop to work out how we work together essentially. So I think there'll be kind of nuances where we'll want to signpost to Southdown and vice versa. But yeah, that's like a lot of work's gone into it. Thank you. I'm excited.
Oh, no, thank you, Dave. And yeah, and I definitely know that Stuart and I have talked about coming to visit you to think a bit about exactly those nuances of like how do we move open access and how do we kind of make sure that we're working alongside one another. So yeah, thank you. Come and visit soon.
Brilliant, thank you. And Frederick, is that a legacy hand, as they call it?
Sorry, I'm back again, Rebecca.
That's
you
okay.
mentioned the underutilised buildings. Are there any details available on these buildings, the location, for instance?
Yeah, so I mean, they are our East Sussex buildings, so more information to come. But I'm interested to know whether you're asking for, is there a specific need that you're looking for? It's really helpful for me to be aware of that. As long as Stuart's also aware, so yeah.
Yeah, I don't know if you all know, I help in running Just Friends, the charity, and obviously we have a percentage of our membership who have mental health issues.
Yeah.
So there is that connection between the two, and I'm thinking of charities actually using your buildings that are underutilised, which spreads the awareness of not only the charity, their objectives, but the mental health issues as well.
Yeah. I think there's lots of opportunities. So, I mean, some of our buildings are busier than others. For example, our Hastings building has got staying well in the evening, so obviously that's around. But our other buildings, there's evenings, there's weekends as well. So I think, there's much more to do with it. And I think, in East Sussex, we'll do that in partnership with Stuart Reed, who's also here. We'll be looking at those opportunities for what's the local need and how can we support that.
Yeah, that was one of our aims as commissioners. We just wanted to open that out a bit and have a little bit more partnership opportunity, if possible, within the financial envelope. But yes, watch this space really, and it will continue to develop. Okay. On that note, and thank you, Dave, for your question. I've inserted a slide for you, which I just copied from your website because it was a very good graphic. But I don't know if you want to, if you've got your own slides, or if you want to just speak to this, or whatever suits you. Oh, you're on mute, Dave. Oh no, you're not.
Thank you. Yeah, no, I'm back on now. Thanks, Sarah. That's that's really helpful. And I can kind of speak from this actually. That's fine. So we've got some updates about the Wellbeing Centre and some of our partners. So we're in from January the 6th on the Tuesday. We'll be opening earlier at 9 a.m. and that's going to be every morning except on Thursdays. We'll be opening at 8, and that's specifically for rough sleepers. So they can come in and get a breakfast and especially during this cold weather, if they're out, warm up and and have a shower and scrub up. So that's really good. While we're on the subject of food, we're also doing Tuesday mornings eat yourself well breakfast. So it's healthy, nutritious breakfast, and that's laid on as we open at 9 a.m. on Tuesdays. So that's actually already up and running and very popular. So we're also getting a grant to help with the cost of the food. So that's a bonus too. We've for some time now we've had IC24 supporting with a nursing clinic, and we also have a weekly GP clinic, which is really welcome. Nurse Kaz is changing her clinic times from the new year again to Mondays 10 till 3 and Thursdays same again 10 till 3. And on the Monday afternoon we also have the GP, so we've got the two clinics running concurrently. So yeah, they're walk-in clinics as well, so there's no appointment needed. Anyone can just access without the appointment. So it's a really great asset to the service that we offer. And recently we've had some major sort of refurbishment, and one of the main spaces that we've kind of upgraded is the area at the back, which was formerly just a gym. So that's all been kind of decorated. We've got air conditioning in. It's looking great. We've had all the kind of glass in the roof replaced as well. So it's a really light and airy space, and it's really a blank canvas with a brand new kind of non-slip floor, and we're able to do gym. There's a band comes in and does practice there, the Dusty Lilacs, the Seaview band. We have art workshops. We've had some yoga and qigong classes as well. We've also been using the space for training, and yeah, it's really versatile. And we're also keen for other groups to come in and use that space. So there are kind of gaps in the timetable each week. If you've got an idea that you'd like to deliver some kind of activity, do get in touch. We'd be happy to help. And then moving on to COPD screening and Swap to Stop, the vaping service. That's currently open on Friday mornings, and our nurse volunteer Anne is there to help people to transfer from smoking to vaping, and to also get refills for their vapes, answer any questions, and we're really excited to announce that it's sometime early in the new year, probably January time or possibly February, we'll be having a COPD screening service thanks to our colleagues in public health, and that'll be also supported by IC24 and our kind of GP as well. So we're hoping to engage lots of people that are in need of screening, and then signposting them onto appropriate treatment from there. So we're one other thing, just a group that's running really well is on Wednesday afternoons. We're open for a women's group, and that's provided in partnership with Brighton Women's Centre. It's a safe and supported space. Many of the issues discussed are around health and well-being. It's a nice social hub for women just to meet. It's quite informal, and we often have art groups happening at the same time. So it's just a great space, for everyone to, all women to meet up and get together. I think I'm more than happy to answer any questions. As far as the training's concerned, we're still delivering this lived experience drug and alcohol training, and we've got a session early in January, which is actually full, so we're really pleased about that. But we're also offering that training to the wider workforce. So if you are interested in this kind of introduction to drugs and alcohol awareness, please do get in touch. We'd be happy to reserve a place for you on the next available course. And that's it from me. Thanks, Sarah.
Lovely, thank you, Dave. Dave, would you mind putting your email address into the chat so people could access that training if they were interested, the drug and alcohol? That would be fantastic. Thank you. And Kenny and I went to visit Seaview a couple of weeks ago, and it is beautiful. It's all been refurbished. It's a really nice environment. Really job well done to you and all your staff, Dave. It's looking great, and it's really nice to hear about that sort of wraparound support that your visitors get. So thank you very much. And we've got a question from Karen.
Yeah, hi Dave. Just wondering if you have like a timetable or kind of a quick snapshot of what services you have on what days. I'm looking on your website and I can see that it does mention, but I wondered if there was like a quick overview.
Yes, it is on the website, Karen. We do.
Okay. Am I looking in the wrong place?
Yeah.
I'll pop you an email.
Yes, I'm more than happy to. We also provide a weekly planner, which is kind of updated regularly. The website is kind of more general opening times, and the weekly planner changes because it is very fluid. So we're kind of responsive to service users' input, and we're always trying new things, which sometimes become sustainable, but often they'll kind of end, and then we'll put something else in place. So it is a constantly changing kind of activity timetable. But yeah, more than happy if you'd like to kind of receive regular updates about that. We'll be happy to help.
Oh, fabulous. Thank you.
Brilliant, thank you. Are there any other questions before we go to a break? Okay, lovely. I didn't say at the beginning, if anyone else wants to put their contact details into the chat, I just share those after the meeting, because I tend to blind copy everybody for other communications because of the dreaded reply all mainly. So yeah, if you want to share your contact details and anything that is going on, or just your name and what you do, that would be fantastic. Frederick.
My apologies, but I have to leave you now. But thank you for the opportunity to be at least with you for the first part. And you have reminded me that I can listen to the recording anyway.
You certainly can. Yep, I will post that either later today or tomorrow, Frederick, so you can do that. But thank you for your questions. Take care.
Many thanks indeed. Bye, everyone.
Thank you.
And a Merry Christmas to everyone concerned.
Oh, and to you. Take care.
Bye-bye.
Bye-bye. I don't know how he does it. The energy of a 20-year-old. Okay, so can we take a break then, please? Rather perfectly timed. If we can come back at about 11 o'clock. But as I said, if you get the chance, just if you want to put your contact details in the chat, that would be fantastic. And I'll see you at 11. Thank you. Hello out there, and welcome back. Peter, are you back in your chair? Possibly not. Oh, nice backdrop, Peter. Hove seafront? Can you hear me? I can't hear you because you're on mute at the moment. I was just admiring your beach huts.
Thank you.
Okay, welcome back, everybody. No need to put your cameras on unless you want to. So we've got Peter from Mind in Brighton and Hove. I don't remember, I think you have been here before to the group. Yes, yeah, but just to give an update on what's happening. So I'll hand over to you.
Hi everyone. Yeah, so I just wanted to let you know in advance of a fund that we're going to be launching early in the new year. So it's called the East Sussex Mental Health Connection Fund, and it'll be launching on Monday the 12th of January. So I just wanted to go through a quick overview of what that fund is and where it's come from in advance of it launching. So next slide, please. So some of you may have been aware that we had delivered an East Sussex men's mental health training and skills project. And what we want to do as part of the final phase of work, which was commissioned by East Sussex Public Health, was to continue to think about how we can strengthen the existing services and spaces that might exist, or opportunities for new activities to be developed. So a particular focus on how we can support people to have connection with one another. So particularly that strength-based approach of people with lived experience supporting other people, but also recognizing that people may be on different phases of their journey, so they may not necessarily feel comfortable going to a peer support group, but may want one-to-one support. So that can be included within this. So next slide, please. So the East Sussex Mental Health Connection Fund will support initiatives that aim to create opportunities for people in East Sussex to connect together, undertaking activities that help improve mental health and well-being. So the total fund in this remaining part of it is £30,000, and we'll be offering grants for between £200 to £2,000. And we especially encourage applications that support people in rural parts of the county and those from marginalised communities. And it's not exclusive to, but that could include LGBTQI plus people, migrants, refugees, Gypsy, Roma, traveller communities, and other racialised communities. So particularly recognising that they may have poorer outcomes because of societal or institutional barriers. And yeah, different ways that we can help them to connect with other people with lived experience. So we also took on some feedback and recognizing that, again, there's a real broad spectrum of services and spaces that currently exist, and what it is that they may need to either sustain themselves or develop new ideas. So previously, the last round of funding, I think we're giving out grants of between 500 to 1,500. I think we've referenced quite a bit already today in terms of those rising costs, but also that some groups, for example, it may be centered around, I don't know, venue hire and tea and coffee to facilitate that. So we also wanted to bring down the sort of starting, I guess the lowest end of the grant as well down as well. So it really hopefully reflects the needs of different groups and spaces to be able to deliver those activities. And then I've just got a slide in terms of key dates that we're working towards. So applications will open on Monday, the 12th of January. and they'll be available on our website. We're going to create a page which will be /ESX fund, which will be on the next slide. It's not there at the moment, so don't rush across. And there'll be some guidance notes, an application form. You can also contact us if you have any queries to see about how your idea may be able to fit within the fund's aims. And then the deadline for applications is 5 p.m. on Monday, the 2nd of February. We do know from past experience there is a possibility that we may open for more rounds if not all of the funds are allocated in that first round. So if you aren't able to get your application in that time, it's possible it may open again, but I can't sort of guarantee that based on what the demand may be. So we're also then aiming to let successful applicants and unsuccessful applicants know a couple of weeks later following the panel meeting to go through those applications and score them accordingly, with an expectation that project delivery would run between March 2026 and February 2027. And then again, continuing on from the structure we had from the previous rounds of funding, is just a brief overview of how the funds have been spent by the end of the financial year. So all we were asking for last time was up to 2 pages summary of how that's been useful, and what that's allowed you to do in terms of connecting with the key groups or the area that we want to make sure that there's more opportunities, particularly for people in rural area, to engage in those peer-led activities. And that's it. Any questions?
Thank you, Peter. I was going to ask a question just in terms of, so the Mental Health Action Group does have quite a reasonable catchment in terms of partners, but I just wondered about pushing it out there. I mean, I guess the VCSE Mental Health Network would be a good start, wouldn't it? Because I think they probably have some of the small organisations that can't really have somebody coming to these meetings.
Yeah, exactly. We're really conscious of that. We really want to look at sustaining people that already exist. And again, similarly, what we had in the previous funding round is it doesn't need to be kind of a well-established organisation. It's also about community leaders, people that have those ideas, because in a way it can be an incubator fund to kind of test an idea. I think particularly if you don't have that financial backing, or like you said, the sort of the resources or infrastructure to do that. So definitely we want to try as much as we can to connect with smaller organizations or individuals. So yes, if anyone's got any ideas, or if you have connected with any groups or individuals, do let them know. I've got a coordinator starting on Monday the 5th of January, so she'll be delivering kind of different assets that we can share across different networks and try and raise that awareness. And likewise, if there are any groups or spaces that you think it would be good for us to go along and introduce ourselves and the fund as well, please let us know. That is our, I guess, our front door email, info@mindcharity.co.uk. So yeah, do reach out to us.
Brilliant, thank you. One of my colleagues, Michelle, has asked if we can share just your slides. I've already got those, so I will send those round after the meeting as well. I don't know if you want to share your email address as well in the chat, Peter. But that's good to hear about some funding that people can access. And I'm sure those little pots will make a big difference.
Yeah, and a massive thanks to East Sussex Public Health for helping establish the fund in its original inception, and yeah, just continuing to try and bridge sort of communities coming together and thinking about different ways that we can sustain or explore new ideas. I think it's needed more than ever, and particularly for marginalised communities.
Yeah, definitely, well said. Okay, thank you very much for that, Peter.
Thank you.
And yeah, I will send out those details. Okay, this next part is going to be very quick because it's me just doing Sarah Dean's slides because she's unexpectedly not able to be with us today. So you can see there's a link to the recording, which I think you can access when I send this round as a PDF, because if I send it around as a PowerPoint, it crashes people's inboxes. So coming up, there's an in-person event on January the 27th in Shoreham. I went to the last one, which was in Eastbourne. It's good just to network, actually, and there's not that many face-to-face meetings, so you might want to attend that. It's not just for people from VCSE organisations either. There's also a survey, so you can see there Sarah's asking you to connect with her about that, and the newsletter is always really good, lots of information in that, so if you're not already signed up, that's what I would recommend. So that saved us about 8 minutes, so we probably will finish early today. So moving on, it's me next as well. Jenni, please feel free to chip in. So Jenni chaired this group, which was a pan-Sussex, well, it is still a pan-Sussex mental health services communications group. I think you've heard about us as we've worked along. We had a campaign last Christmas. This year, it's not specifically about the festive season or anything like that. It happens to coincide with, but actually what we've been looking at is focusing on people who might be digitally excluded, because the first campaign was very much online, social media. To some extent, people who were digitally excluded could access it, but there was a concern that we perhaps weren't reaching all of them. So part of that is that not only have we got actual pieces of paper, which have been circulated to places like food banks and libraries, we've also included phone numbers, which are quite old-fashioned things, but it means that people who are not online or suspicious of going online, for whatever reason, there are phone numbers. So that includes a number for Southdown services. So you'll see there's like a hierarchy of services depending on whether you're in crisis or whether you want to access something to do with substance misuse, etc. So so that's all been produced. The leaflets have gone out. We're not sure what to do with the ones we've got left because it was a very finite budget. If you do want those leaflets, you can ask for them. We'll try and get them to you. But as I said, we did try quite hard to get them to places that actually were not medical, not healthcare, but where people might go to. Citizens' Advice is another one where we've distributed those. There was also posters. The posters were digital, so they had a QR code, which means that you can just obviously use your smartphone and go straight to that central website, which then takes you through. And if you're in East Sussex, it takes you through to the local services, which is really helpful. The mental health directory, the East Sussex Mental Health Directory, reflects all of that sort of in terms of the wording. And the list of services. The other thing that we've done is that all of the communications were looked at by people who had neurodiversity, so who are neurodivergent, and so things like the colour palette was taken down. I find really bright colours quite difficult, so it was really taken down, and some of the wording was changed, so that's been taken into account. And then the third group of people we looked at were those who do not have English as their first language. And so it was decided that there were 5 key languages across Sussex. Again, we had a finite budget, and it was quite difficult to decide which languages to choose. So you can see there those 5 languages that were chosen. So there are hard copy leaflets that are available if people want those for their communities. And you've got an email address there in order to contact and get hold of those. There will have been something that came round from me, which included the whole pack. And this is where I don't understand. I don't do social media, but there are social media comms that you can. Is it retweet? No, it's not tweeting anymore, is it? But anyway, those are coming round. So please do that for your organisation, so that those are shared. Lastly, there is a grayscale document which is intended for a cheap way of getting this information out to services. So, for example, I've sent it to quite a few of our adult social care teams. So they write letters to people, old-fashioned way. and they just then attach this grayscale list of resources to the back of their letters, print it out, and it gets sent out all together. So that's what they're doing. So there's no need to worry about us sending you leaflets. You can just print this thing out and send it with your communications. So those are the set of resources that we have. Have I missed anything out, Jenny?
Nope, not at all.
Okay, well, that's good. And then I've just to show you what it looks like. This is the co-produced leaflet. So you have to imagine it gets folded up. So this is the sort of the front and back, if you like, of the leaflet. So we've stuck with how are you really feeling, because it was felt that that was appropriate language to draw people in. We've adapted some of those graphics. It has got the QR code, so if you want to, if you would rather access things online, you can do that very easily. And it also directs people who are under 18 to the children's services. And then inside, it's got the kind of the main services from crisis through to talking therapies, through to your sort of local mental health and support. So, and you can see there it says Call You OK Mental Health and Wellbeing Support, which has got a number there. Care for the carers, which Richard and James, you know, you're a vital part of that support for a lot of people. So there we go. That's the leaflet. So yes, please email as appropriate to get hold of those if you would like some to distribute. And then I just wanted to touch briefly on cost of living support, because you know that the crisis is not going away, it is getting worse for many people. So the East Sussex County Council have produced a cost of living leaflet, which is on the next two slides. If you'd like a copy, Carly will send you out those. They have been fairly widely distributed, but there's always more to do, and there are more copies available. And I've also just pasted in there the importance of promoting financial well-being. There's a really good gov.uk article about services and how you can add value by understanding some of the difficulties that people are having and being able to signpost and so on. And that leads neatly on to the free money guiders training, which I'm always banging on about and sending out stuff, but there's free training still available if you want to skill yourself up so that you understand the benefit system a little bit and are able to signpost people appropriately, because it really does help with their mental health if you can help sort out their financial health. And then this is the latest version of the cost of living leaflet. There's also the cost of living web pages, which are regularly updated and really useful. So I included the link to that. So yeah, you can see it's got lots of different helpful, again, phone numbers, so people who might not be online, and then the inside of it. So lots and lots of information on there. Are there any questions about any of that? So the comms or the cost of living? Whistle stop tour. Okay, thank you very much. I will hand over then to Jenny. So we, a while ago, we combined the Suicide Prevention Partnership Group with the Mental Health Action Group. So for those of you who might not be familiar with that, Jenny has a regular slot where we want to bring in agenda items around suicide prevention. Obviously, it's a bit difficult to separate sometimes. So anyway, we always have this on the agenda. And if you have anything that you'd like to add or contribute either to this section or the earlier section of the meeting in future, then please let us know. Jenny, shall I hand over to you?
Yeah, thanks, Sarah. And just to say that there's a few things just to update on this time. Sometimes this part of the agenda, I would kind of give a bit of a warning to say that obviously we may be talking about sensitive material. We're not really particularly today, but nevertheless, if people are uncomfortable and wish to dial off at this point, please do so, because for whatever reason, sometimes people find this topic difficult. But rest assured, there isn't anything too sensitive today. So I just wanted to touch on the men's health strategy. Now, this is a men's health strategy. It's not specifically mental health, but it represents the first comprehensive 10-year plan that's dedicated to improving health outcomes for men and boys. And its purpose really is to address the persistent health inequalities, the reduced life expectancy, and an enhanced overall well-being around men's health. So it's quite a key document that came out just in November, just so it's still pretty new, but there are relevant bits there within there around mental health and particularly around suicide prevention. Next slide, please, Sarah. So it's basically built around these 5 key pillars, which, as I say, are designed to create a holistic approach to health improvement for men's health. So as you can see here, it focuses on improving healthcare access. So recognising that sometimes men may not, for various reasons, particularly engage with health services, and particularly around mental health support. The supporting healthy behaviours bit is around promoting that lifestyle changes and improving physical activity and reducing substance misuse, really in that context, a kind of reduced life expectancy that we sometimes see in particular communities for men. Creating healthy environments, so focusing around sort of workplace and community settings that support well-being for men. Fostering those social networks, so again looking at kind of things around reducing isolation, encouraging better connection, etc. And then finally this bit about tackling stigma and challenging those societal norms to help men seek help earlier and you know, improve their access to support and services. Next slide, please, Sarah. So there are within the strategy some key recommendations around suicide prevention, and the reason for that really is that suicide remains the leading cause of death for men under the age of 50 in England and accounts for 3/4 of all suicides nationally. So the strategy sets out a comprehensive framework to tackle suicide among men through several core recommendations, which collectively aim to create a multi-layered approach that combines awareness, accessibility, and community engagement to reduce suicide rates among men. So firstly, it calls for breaking down barriers to help seeking by addressing stigma through national campaigns and partnerships. And some of you may have seen some of the adverts associated with the Premier League Together Against Suicide initiative, which is being run in conjunction with Samaritans. And this collaboration leverages football's cultural influence to normalise conversations about mental health and embed supportive messages into matchday experiences. Secondly, the strategy prioritises high-risk groups and focuses on middle-aged men in deprived areas where suicide rates are disproportionately high. It thirdly advocates for co-designing services with men who have lived experience of mental health crises, ensuring interventions are relevant, accessible and effective. And then finally, the strategy emphasises integrating mental health support into everyday settings, including expanding mental health teams in schools to reach an additional 900,000 pupils by 2026. That's a big challenge. We'll see how that goes. Next one, please. So it does translate its recommendations both into tangible actions at both national and local levels. So nationally, it's allocated 3.6 million for suicide prevention, targeting middle-aged men in high-risk areas. And that will be aimed at projects that dismantle barriers such as stigma and lack of awareness, while also providing tailored support. So in addition to the Premier League partnership, national measures include workplace health pilots, community-based men's health programmes designed to meet men where they are, whether in workplaces or local clubs. And then at a local level, there will be initiatives focused on co-designing interventions with experts and men with lived experience, ensuring cultural relevance and practical accessibility. And these community projects will be concentrated in deprived areas where suicide risk is at its highest. And there will be integration with NHS services and digital tools like the NHS app to help streamline access. And the idea is that together these actions will represent a coordinated effort to reduce suicide rates and improve mental health and well-being amongst men across England. Next slide, please. Oh, I might just pause there if there's any questions relating to the strategy or any comments. If not, I'll move on. Okay, so next, I just wanted to touch on a digital campaign that we're doing with Grassroots. Many of you hopefully know and are already familiar with the Stay Alive app, which has been rolled out nationally. It's achieved awards, and it's seen as a really practical and helpful app for people to have available on their phones, so that if they are in a situation either themselves or in a situation with people who they feel are in crisis, there's a whole load of resources and information available on that app at the touch of a button. So what Grassroots have done elsewhere in the country is that they have run some very successful targeted digital campaigns to promote the app and to increase the number of downloads and people accessing and utilising that app. They received some funding and nationally, and have asked for match funding from local authorities to help promote local promotion of the app. And so in East Sussex Public Health, we have provided a small amount of match funding to enable them to undertake this digital campaign. It's starting imminently, so hopefully these images on the screen you will start to see these. Basically, it's targeted. I'm not a technical person at all, but it's basically geo-targeted digital advertising via using Google and Meta, and it's to deliver targeted messages to those at greatest risk, including by geography, age, gender, and other relevant demographics. So we have provided some data based on case history and also demographics of gender and age, so that we will be focusing the digital campaigns in those areas of kind of where we would see greatest risk. So the campaign messaging has been developed from lived experience and best practice in suicide prevention communications. So it's been tested so that it's safe, accessible, but also impactful. So these are the images that will be popping up on Google and Meta, so Facebook, Instagram, etc., in those geo-targeted areas. Thank you. Next slide, please. This is my last slide. This was just to flag up that for the first time, there's been a British Standards Institution standard published around creating suicide-aware workplaces. So this is actually a kind of a landmark moment that's encouraging organisations to really consider how they kind of prepare themselves or respond to cases of suicide or suicidality in workplaces. And it offers really practical tools and best practice guidance for workplaces to really consider and look at their policies, their culture, whether or not their staff have had training or would benefit from training to help them on this topic area. Also thinking about, as I say, in the situation that there is a suicide in the workplace, how they respond to that and how they ensure that they support their staff. So it's been developed, as it says here, with input from over 70 organisations and experts, and marks a major step forward in terms of creating compassionate and supportive workplaces nationwide. There is a guide, a very practical guide to help workplaces look at this and as I say, sort of review their policies and guidance. And also there is this pledge that organisations can sign up to basically say that they are, that they are suicide aware and have taken those active steps to support their staff in their workplace. So we're used to, I think, in health and social care settings to be thinking about supporting our staff in all sorts of different situations. But this is sort of, it's not specific in terms of health and care settings. It's encouraging all organisations to have a look at this framework and to create their suicide aware workplaces. So I just wanted to flag that up here for people to take a look at. And that's my 3 pieces of information. Thank you.
Okay, thank you very much. Does anybody have any questions or comments for Jenni around what she's just said, or anything around the suicide prevention arena? Okay, right. Thank you, Jenni. Well, we're heading to the end of the meeting. So the next section is partner updates. It's been very quiet. I know there are things happening out there, but I haven't heard an awful lot from people for this particular meeting. I've included there some very nice picture of 2 dogs, and just some information. I'm sure you've had it from other sources as well about support over the festive season. Just in case that's useful to you. I have actually last minute also had some information about, I'll see if I can get it and put it into the chat. So the County Council has worked together with the NHS to offer Oliver McGowan training for autism and learning disabilities. So it's free, doesn't matter what organisation you're from. So I've just put it in the chat. So this came from my colleague, so from Emma Waring. So she couldn't be here today, but she just wanted to share that with you. So if you're interested in taking up that training in the new year, please get in touch. I think that's the Autism Partnership Board team email. Are there any other updates at all? Or I was thinking if anyone's got any nitty questions or things that they'd like to say, problems that they'd like to be solved. We can't promise that we can, but we've got a few minutes actually. Ricky.
Yeah, just quickly, Sarah. I know everyone spoke about co-production a lot today, from the neighbourhood mental health teams to the great work that Seaview are doing, to the neighbourhood mental health teams. Well, coming up in February is the next co-production conference for Sussex. It's the hottest ticket in town, as always. I think there's already been over 90 or 100 tickets reserved. And that went within about 2 days of the event being announced. This one's called Co-Production Back to the Future. So I guess there's going to be lots of puns and funs and games going on. I'm just about to put the link in the chat for people to get a ticket. And also something else that this conference will have is a chance for you to nominate your organisations that are doing some really great work in co-production. And I know that, we've had great few speakers today, Frederick and Dave, and people that have been doing some really great work in co-production. So if you want them to pick up an award in February and represent East Sussex, then please use the link I'll put in the chat, nominate everyone, and yeah, sign yourself up, because February the 11th sounds like a long way away, but blink and it will be here.
Very true, Ricky. Thank you. Yes, so if you could put that in the chat, and I have actually got an email which I can forward as well. I think I did a few weeks ago, but I'll do that again in case anybody missed it, because that is a really good event to go to. Thank you. I can see there's a few other things in the chat. So mine, Brighton and Hove, their Christmas openings in there, and I'll share anything else that you'd like to put in there. Is there anything from anybody else that you are brave enough to share? I don't know, something that you're doing next year or thinking about doing? This is your last chance. Give you a minute to think. Okay. Oh, we've got a taker, Jenni.
Sorry, just as a slight aside, although I do think it's highly relevant to mental health. We are. Some people may be aware that from earlier this year, a levy was brought in on gambling operators. We have set up a gambling prevention partnership group in East Sussex. This is a growing area of focus for us. With the levy, there will be funding to focus on both prevention, treatment and research around gambling harms. We don't know yet exactly how that's all going to pan out, but there will be a programme, or we will be developing an action plan focused on gambling harms prevention. If there's people on the call who have interaction with people who are either experiencing or they feel may be at risk of gambling related harms and you are interested in this topic, please do get in touch. In terms of, I can share more information about the Gambling Harms Partnership Prevention Group, perhaps in a future meeting. But yeah, if you've got queries or interest in gambling harms prevention, please get in touch.
Brilliant, thank you, Jenny. And also, I was just going to say, if there's any other agenda items that you'd like to bring along to the next, it will be in March. It's unbelievable, isn't it? March 2026. Then please let me know. At the moment, I've penciled in an update on autism, and I think we'll probably have news about the neighbourhood mental health teams, hopefully being bedded in, and actually before that we'll have some communications to share with the people that you work with. So yeah, all good. Thank you very much for your time today, and thanks for all the speakers and your questions. And yeah, I can see Richard, you just put your information about care for the carers into the chat, so I'll share all of that. Have a lovely Christmas and New Year. Hope you get some time for recuperation and come back 2026 bouncing into the new year. And thank you all.
Thanks, Sarah.
Thanks a lot. Take care.
Thanks, Sarah.
Thank you.
Bye.
Thanks to all the speakers. Thank you.
Thanks, Sarah. Bye-bye.